Uh, Dear everyone, thank you for giving me a chance to talk in the Global Traditional Medicine Conference today. The topic I'm going to share today is the present and future of traditional medicine in the next 10 years. And I know that's a big topic. So today I just want to focus on the Vietnamese situation currently and in the next 10 years. This is the agenda today. First of all, the introduction and primary goals of the presentation today. And then I want to focus on some areas that World Health Organization can support the members, especially developing countries like Vietnam. And then some difficulties when we practice traditional medicine in Vietnam and also when we conduct some research over there. Later that, I will mention about some proposed solutions and the conclusions. First of all, the introduction. According to World Health Organization, WHO, traditional medicine includes knowledge, skill, and practices, which are based on the theories, beliefs, and experience indigenous to different cultures, used in the maintenance of health, as well as the prevention, diagnosis, improvement of treatment of physical and mental illness. So in Vietnam, actually, we use all of those areas of traditional medicine, like prevention and diagnosis, and also improvement of treatment. And especially nowadays, we try to combine all the treatment from Western and traditional medicines. Make sure the patients can have the best treatment that we can offer. And from 2014 to 2022, WHO has supported members in various aspects of traditional medicine implementation, including research and knowledge. We have some clinical evidence database, traditional medicine knowledge platform, integration of traditional medicine in national health system, promoting safe and effective use of traditional medicine through regulation and research, and development of standards, norms, and technical documents. So the primary goals of my presentation today is just I want to talk more about the sustainable development of traditional medicine, particularly in Vietnam. And then I will show more about the difficulties analysis when we practice traditional medicine and conducting traditional medicine research in Vietnam and propose some solutions. Actually, from the last 10 years, there are some areas that WHO can support. First of all, that is leadership. So WHO helped to harness the potential contribution of traditional medicine, also promote safe and effective use of traditional medicine. More than that, they help to review and assess the existing models of integrating in member states like Vietnam. And finally, they have organized some centers like International Regulation Corporation of Herbal Medicines. The second aspect is research and knowledge. WHO have helped in terms of clinical evidence database and also traditional medicine knowledge platform. Later on, I'm going to show you an example of an terminologies that WHO has published this year. It's very nice and beautiful over there. And then the third one is the standards, norms, and technical documents. So actually, we have some global guidelines on quality and safety of herbal medicines. We have the key technical issues for the safe use of herbal medicine with reference to interaction with other medicines. And also they have the methodology for clinical study in traditional medicine. And finally, they help to develop web-based international terminologies. And finally, the WHO also support in building institutional capacity. They have to train um, workshops for capacity building of government officials, also have to build the standard for training in traditional medicine. And also currently they have to develop some standard for training in cupping, Tibetan medicine, and yoga as well. So this is one of the example that I just mentioned above over there. This year, WHO has established the WHO International Standard Terminologies in Traditional Chinese Medicine. You can have a look in the left-hand side. So it's very interesting that they give the English term and then the synonyms and also English definition and Chinese term and Pinyin term as well. So it's extremely helpful for people who cannot speak Mandarin. And this is a really good guide for them to combine English and Mandarin together so we can work together in the near future. So there are some types of traditional medicine used in the whole world. We have acupuncture, herbal medicine, indigenous traditional medicine, hemopathology, traditional Chinese medicine, naturopathy, chiropractic, osteopathy, and others. And particularly in Vietnam, acupuncture and herbal medicine are used like nationwide. And then we also use traditional Chinese medicine. We try to combine all the options that we can help the patients. Then we move to the types of traditional medicine degrees and training programs. This is the one for the whole world. So we have bachelor, master, PhD, and then other higher education, clinical doctorate, PhD. Also, some country they offer master, bachelor's, only master and bachelor's. And then they have other university level training. And also they have some technician and also training for training program and others. So in Vietnam, actually, at the moment, we have all of those kind of training programs. We have the bachelor's, like the basic one, and then master and PhD, and also we have all the clinical doctorates, and also certified training programs like in massage, in acupuncture, and so on. When we practice traditional medicine in Vietnam and also we do research in Vietnam, I think developing countries also face some similar difficulties. We have lack of research data over there to support our research, and also we lack of financial support. It's very hard to try to find funding in Vietnam. And we are trying our best to do research in our country. And then we have lack of mechanism to monitor safety of traditional medicine practice, lack of education and training, lack of expertise with national health authorities and control agencies, lack of appropriate mechanism to monitor and regulate traditional medicine providers, lack of appropriate mechanism to control and regulate herbal products, and also lack of mechanism to monitor and control other traditional Chinese medicine products as well. So over here, we can see that, first of all, that's the research data is the main difficulty. And then we can see the financial support or the funding is another problem. And all of other problems like relating to human resources and the system. So I'm gonna go deeper in the Vietnamese condition at the moment. So there's a timeline of traditional medicine development in Vietnam. So since 2003, so just nearly 20 years ago, in Vietnam, we issued the Vietnam's national policy in traditional medicine. And then in 2009, we have the regulation on medical examination and treatment with traditional medicine. And actually in 2017 and 2018, we have some regulations on herbal medicine and traditional medicine. And very interesting, in 2017, the government, the health department, they published the 5th edition of Vietnamese pharmacopoeia. So totally we have 1,519 national rep standards over there, so including 372 standards on medicinal materials and traditional medicines. And then in 2017, May, the Minister of Science and Technology has announced 25 national standards of post-processing medical materials. In addition, Vietnamese law allows reference to other countries' pharmacopoeias, including China, Hong Kong, Japan, and Korea. And then in 2022, so at the moment, we try to foster holistical superior methodology to develop traditional medicine. And hopefully in the next 10 years, we can increase both quality and quantity of traditional Chinese medicine practice and research. So we in here have the Vietnamese education system for traditional medicine doctor. So the basic E in the graduate. So it's gonna be 6 years to get the certificate. So we're gonna get the title traditional medicine doctor after graduation. And after that, it depends on individual, like which way they want to go. If they want to go more on clinical sector, they can go with specialists, and then take them 2 to 3 years to finish the first step, and then they can move on to the second one in take them 2 or 3 years more. Yeah. And then if they choose the second pathway, they can be a resident doctor, so about 3 years. After the resident doctor, they can have the master and also specialist certified over there for them. And the third way, they can do master or PhD in traditional medicine. So master normally lasts about 2 years, and PhD can be done from 5 to 7 years. So actually in 2017, when we do some calculation, there are about 600 practitioners in traditional medicine in Vietnam. And every year we have about 200 to 300 new graduation. So hopefully in the next 10 years, we're going to increase the quality to about 3,000 practitioners in Vietnam. And so the plan for traditional medicine development in Vietnam, uh, I want to propose over here, we're going to be focused on 5 factors: the leadership, research and knowledge, standards and norms, building institutional capacity and cooperation, that align with the WHO recommendation. And with the leadership, we can see that we're going to try to promote safe and effective use of traditional Chinese medicine, to focus more on the regulation. And every year, the government also update their regulation, make sure that the way we practice is safe and effective. And the second one is research and knowledge. So we're gonna focus on clinical evidence database, do more research, and then we can gradually get more data, and then we can improve our system in doing clinical research. The third one is standard and norms. And luckily that WHO this year already published the international terminology in traditional medicine. So we're gonna follow that guideline, and then hopefully we can have an online system so we can use the same language, same norms and terms. And then when we introduce or we present with the international conference, we can understand each other more. The fourth one is building institutional capacity. So this one, we're going to try to integrate regional training workshops and for capacity building of government officials. So mainly focus more on training and more on the government officials. And finally, incorporation is this one of the most important in my opinion, because we can establish corporate channels not only inside Vietnam but also with other countries as well. Then there are two main areas that we actually need to focus if we want to develop traditional Chinese medicine in Vietnam. First of all is the research area, and second one is the education and training areas. So as we can see before, that the main problem, the main difficulty of research is the funding. So we are trying our best to develop the strategies to attract funding and financial support, not only from the government, but also from the non-government organizations and from the whole world as well. And then we also try to establish cooperation channels between national health authorities to share information. And so we have some cooperation channels at the moment with Asian countries like Singapore, Thai, Laos, Cambodia, and recently we have some connection with Korea and Japan. And then we also want to publish guidance in conducting traditional medicine research. It's very important to like have a guidance, and then all the research can follow that guidance, and then they meet the standard in the country first, and then gradually we can meet the standard of national and international standard. And then finally, in the research area, we also try to establish the online clinical database. So it's easier for all the researchers come online and then try to find data, and then they can do articles and to support for their research. And the second areas we want to focus on is education and training, because human resources is extremely important. So we are trying to improve the quality of the practitioners and also the researchers in Vietnam. So first of all, we find a new approach to corporate strategy. So we can connect from different regions, different university inside Vietnam, and also we can connect with the university outside Vietnam. First of all, in the uh, Asian country, and then we can try to connect with other countries from other continents as well. And then the third one, we also try to develop and cooperate between national health authorities, similar with the one I just mentioned above. And finally is launching online education platform, easier for everyone to go online and study and gain more knowledge if they get connect to internet. Mm. So in conclusion, with the aim to develop traditional medicine in Vietnam, establishment of online clinical evidence database and traditional medicine education platform is fundamental and inevitable. They could be valuable resources for research and education, and moreover, cooperation channels with other national health authorities to share information also plays essential role in traditional Chinese medicine sustainable growth in Vietnam. So there's a quote over here, like from Yo-Yo, the one who got the Nobel Prize in Physiology or Medicine in 2015. She said, every scientist dreams of doing something that can help the world. And the same with our team, and as we are trying to our best to help and to change the world. And thank you for listening.